This week on Africa Health Check.
The quarter meetings to teach people how to social distance.
And then you always need to wear your face mask and then sanitize.
We review how public-private partnership.
Ouais, ce que nous faisons pour nous protéger de ce virus, c'est respecter les mesures barrières. Les mesures barrières qui ont été dictées par l'OMS d'abord.
Has collaborated in fighting the pandemic. We will be discussing one of my favorite topics, public-private partnership. We review the collaborations of public-private partnership and contributions to the COVID-19 response, as well as reducing the impact of the pandemic on industries and economies across Africa. But before we get into the discussion, let us have a look at Africa in numbers. This week in Africa in Numbers, we highlight vaccination rates of the top 5 countries as at the first of New Year according to the Africa CDC. Top of that list is Seychelles with 78% of its population fully vaccinated, followed by Mauritius with 70%. Morocco comes in third with 62% and Botswana and Cape Verde wrapping it up with 43% and 42% respectively. Check out the official Africa CDC website for these and more statistics. And that is our Africa in Numbers segment. For today's episode, we have a special guest, Advocate Florence Nabweteme from Uganda, who's a gender and human rights activist and has done a lot of work on public-private partnerships, so we look forward to learning a lot from her. As usual, we have our commentators, Dr. Marianne Moreithi, who's the current chair of the Department of Medical Microbiology and Immunology, as well as the senior research fellow at the University of Nairobi, Kenya, and Reverend Anthony Achampong, who's a pharmacist and a pastor. And now we're going to jump into our discussion. Remember, we are talking about public-private partnership collaborations and how they contributed to the fight of COVID-19 over the last year and a half, as well as how they helped in reducing or curbing the impact of the pandemic on industries and economies across Africa. I'm going to start with Advocate Florence. Please introduce yourself, tell us who you are, what you do, and where you're from.
Hello, everyone. I'm Advocate Florence Nabweteme from Uganda. I'm a legal practitioner, private practice, and I'm also a gender and human rights advocate.
Fantastic. Maybe just share with us a little bit about your work as an activist.
All right. I've done work around sexual reproductive health and rights, and also seeing that women and girls occupy spaces in the corporate world, and advocating for women getting paid for the care work that they provide, and seeing how women can be more represented at different levels of decision making, because there's a lot of women doing a lot of work in the unpaid sector, and we're not seeing a lot of women occupying, owning companies, getting highly paying jobs, and which widens the gender inequality gap, and as a result leaves women very disadvantaged. So I have a lot of interest around such work, and women getting their voices being represented out there in the public.
Absolutely great. And what would you say so far has been one of your best experiences or moments working in sexual reproductive health and rights and gender equality activism?
I think there have been a few milestones, but a lot of work still needs to be done. There's been a lot of women getting jobs, being represented internationally, and there's been a lot of women starting up businesses and supporting fellow women. So we are seeing a lot of that. And also, there's a lot of women coming out and speaking out on gender-based violence, which is, I think, a great milestone, because when women are talking, when women are engaging, then a lot of women's rights and being recognized and are being protected in that respect. I think whereas there's been little improvement seen over the years, but a lot of change in our social norms and how we see things and our cultural perspectives have been, the exposure has actually helped a lot. So I think for me, that's the milestone, though a lot still needs to be done. When we see more men getting involved in such discussions, it's a bonus.
Mm. And would you say you saw an active role of PPPs in Uganda during the COVID response, particularly at the beginning when we saw so many restrictions and lockdown? Would you say you saw a lot of that coming out prominently?
Yes, there is definitely an active role because as a government, it's government's obligation to provide social services, infrastructure, roads, healthcare, and education, and all these facilities. So if government is not providing for them, and the private sector takes on government's role, shown the healthcare, and so if government negates its role, then it's transferred to PPPs. PPPs are essentially very expensive, and also by the structure of their contracts, they're not very favoring to women because they are very inflexible. They are very long term. So they are more favoring to men than women. And during the lockdown, we saw a lot of that because so many women who take up 60% of the low-paying jobs or unpaid jobs, or the social labor, were laid off during the lockdown. So as a result, women suffered more and they needed more access to public service. So yes, as a government has a role, the private sector has a role, but as we know it, the private sector is very profit-oriented. And as a profit-oriented industry, they'll look more to the money they make out of the service they're providing, other than the service that they're delivering, or even creating jobs for more women, as you can see. So many women were laid off, and as a result, they had no source of income, and which put them in a complicated situation, and they had to seek out public services that are low cost or they don't need to pay for. So the role of government and the private sector really came out very, very clearly and broadly. And I think the PPPs, it's high time we start reviewing how public-private partnerships work and how they can actually rectify the gender inequality that exists within the economy and the care sector.
Thank you very much, Florence, for sharing that. You know, I share your sentiments as a woman, and I know the intersectionality of the challenges that we face and how we contribute immensely to many economies where we're still left on the periphery. But I wanted to go to Dr. Marianne. Maybe you can share with us what has been the role of public-private partnership in responding to COVID-19 in Kenya.
Yes, so the role of the PPP, or public-private partnership in Kenya, has played such a huge role, and significant progress has been made because of this partnership. I work, or I'm placed in a public institution at the University of Nairobi, where we are located in another public institution at the Kenyatta National Hospital, which is the largest hospital in East and Central Africa. And here we've seen the private sector, or for example, the banking sector. We have one of the biggest banks in East Africa, Equity, which has partnered with MasterCard Foundation and have made sure that hospitals and medical doctors and also medical students within our institution have adequate PPE. And that's really, we're very, very grateful to have that. In that we have the full masks, the full overalls. Again, we have hand washing stations, again donated not not just by this partnership, but other partners who have come together to make sure that within the hospital setting, there are hand-washing facilities scattered across each section or each corridor. Again, we're very grateful for that, because this really contributes to us who are trying to fight the pandemic under the science perspective, under the medical perspective, to make sure also we are protected. I could go on and on about other partnerships that I've seen, and here allow me to talk about the public. We do a lot of research, and for this research we need human volunteers so that we can assess how these vaccines are working. And we have members of public also coming into our institutions to participate in this type of research. I don't know whether you'd call it public-private partnership, but again, we are really thankful to the public members, again, women who come out in large numbers so that they can help us understand some of the reactions, some of the responses, and also contribute to the science field in that African volunteers, Kenyan volunteers are responding to the vaccines or not responding, and this contributes to how we are getting these vaccines and the effectiveness. So that, again, we are very grateful from a science perspective and also from a medical perspective.
Absolutely great. I think one of the really humbling things that we really saw is the spirit of volunteerism when COVID-19 first broke out. I know here in Botswana we had a lot of people who were helping with food donations to people who've lost their income. We had landlords who were giving their tenants rental holidays, understanding that they've lost their income. So I think those are some of the things that may seem trivial, but they did make a difference in terms of preserving livelihoods during such a difficult time. Maybe Reverend Anthony, you could also share a little bit on PPP collaborations that worked effectively in Ghana.
Well, Gigi, we've all come to understand that the fight against COVID-19 is more than a medical or a healthcare problem. We know that its impact is far-reaching, not only about the death of loved ones, but also impacting on the economy, on business, on international travel, and so many other areas of the economy. In Ghana in particular, policy responses by the government at the initial stages allowed the health sector to be able to rise up to the challenge. And when we talk about the health sector in Ghana, you know, Ghana has about 53% public and about 41% private. So if the government or the nation is going to be able to tackle COVID, there is no way only the government institutions will be able to handle this. And that was and it is still the thing that is ongoing, that private clinics, private hospitals, faith-based organizations, and where health issues are concerned are all cashing in to make a contribution. The government also notice the enormous challenges that it has on its hands because of lack of funds, set up what we call the coronavirus alleviation program. And out of this program, government initiated a coronavirus fund, COVID fund, to which banks, private banks, to which manufacturing institutions, private and individuals, all gave generously to that fund. And out of that fund, the government could initiate what we call the e-learning to help children that were locked down at home because they couldn't go to school to be able to access teaching, learning on the TV stations and so on and so forth. So it's been a great help for both the government and individuals and private institutions, all to see that the fight of COVID is the fight of all peoples in our society. So
absolutely. Absolutely inspiring, Reverend. We are going to be talking more about what can be done to enhance public-private partnership in the COVID response, as we are still in the pandemic and still needing a lot of efforts from different stakeholders to overcome this. But we're going to do that right after this break. Let us hear from a word on the street.
Oui, ce que nous faisons pour nous protéger de ces virus, c'est respecter les mesures barrières. Les mesures barrières qui ont été dictées par l'OMS d'abord, mais aussi par notre ministère de la Santé.
You know, in malls and shops, we meet a lot of different people. And when you go to the shops, you touch things that other people have been touching, and you never know where we will get this COVID. I think it was a very good idea from our government to close. Yes, but now the condition has now lowered. It's much better than before.
Njia ambazo zimetolewa za kujikinga zitumike, na popote unapopata nafasi ya kupata chanjo ifikie, ipate, na angalia kile ambacho serikali au huduma za afya zinasema namna ya kujikinga, fuata hivyo.
Right, and that is from the word on the street. We continue our conversation with our panelists on what has been the role of public-private partnership collaboration in responding to COVID-19, as well as reducing the impact of the pandemic on industries and economies across Africa. I'm going to go to Advocate Florence. Many times when we hear about donations coming along, we always worry about accountability in Africa, particularly because many of our countries are characterized by corruption and misappropriation of public funds. What has been your experience in Uganda regarding all the funds that were donated towards the COVID-19 response?
I think in Uganda, at the start of the pandemic, we saw so many private companies donating millions of shillings. We saw them donating vehicles and other items, mattresses, and so many other things to support people, and foodstuffs. But then there's been a lot of public outcry that some of these items did not even reach the people that were intended to reach. But as much as we've really had televised distribution of foods, and people within Kampala and around the metropolitan area of Kampala received food items, they received relief, they received support, which support wasn't extended to some of the rural communities and upcountry areas that really needed the support. So there was a lot of discrimination that we saw, especially in the distribution of those items and giving support to people. So, and with the issue of the accountability, in our country, we've had to form a commission of inquiry into the COVID funds, due to the fact that there was misappropriation, and some of the health workers that they were supposed to use the money to support in terms of the items that were using, the medical supplies and salaries, and also for the time they volunteered during that period, they were unable to get it from the reports that we get. So as much as there was a bit of the persons that were supported and communities that were given the items during that time, there was also misappropriation, and we've seen the private sector step back and totally step out. They've laid off individuals, and they've stepped out of the support for COVID. And because it has seemed like an ongoing issue, that people are used, okay, COVID is here to stay. We don't even have to wear masks.
And that leads me to my next question. You're talking about how, the private sector has sort of taken a step back as compared to last year when the pandemic started and there was so much support pouring in. And I think it's because of this COVID fatigue, that everyone is feeling, especially in the private sector, because of the dent that the COVID-19 pandemic gave the industries and economies because of the restrictions. So I don't know how can we encourage that spirit of, engaging and contributing towards the response to come back again? Maybe Reverend, you can just chip in on that one.
The thing that the message of this platform, in this episode, is that no one is safe until all of us are safe. I mean, the miseries and the burdens of finding or seeking a peaceful and a healthy world environment is a collective responsibility and obligations. No one government can do it all. So if the government is going to woo the private sector and individuals to participate in the fight against COVID, it must be on the canvas, on the platform of transparency, I believe, and accountability. Because more often than not, people's morale towards giving or supporting any government's initiative is destroyed by hearsays of fund embezzlement and people doing things for their own selfish gains. I believe in your question, if the governments are going to have the collective support against the COVID fight, and let them be true to the situation. Let them be accountable. Let them be transparent. And when the people see the fruits of their investment, of their donations, of their giving of their energies, the doctors, the nurses, the banks, and things like that, then the rest of the public will come along, and then the fight will become easier and quicker for us all.
Absolutely. Thank you so much for that. Dr. Marianne, the private sector operates in money, and this is why usually when it comes to corporate social responsibility, the first thing that they do is donate money. But we're talking about issues of misappropriation of funds, corruption, and so on and so forth. As a medical practitioner, what would you say would be the ideal way in which the private sector can contribute to the response to make sure that the funds actually reach the people that need them the most and are used appropriately?
Yeah, so it's a very good debate, and I think that's what we are still currently debating and talking about in the country, about the funds. Money is given, but we cannot account for it, and the people that get hurt actually are the people that need the most, patients, the population that are quite vulnerable, and also the medics who are at the front line, either researching or treating this infection. So yes, money donation is important, but more importantly is what is this money going to do? For us, the biggest need is the PPEs, and it's fantastic to see that we have localized companies. People have come together to make these PPEs, and they are local, so we can have constant supply. There's no short gaps. And another big measure that PPE is playing a big role in, apart from of course the money donation, is vaccines. Remember, this is the biggest conversation right now, and for Africa we cannot manufacture these vaccines for one reason or another, so we are dependent again on this public-private partnership, where we have this vehicle that's known as COVAX. We've all heard of COVAX, where different organizations have come together, both public and private organizations, and they're donating vaccines to the African continent. These are the international organizations, but locally we need more people to come up and say, once these vaccines are here, do we have enough needles? Because again, we can have the vaccines, but we don't have the needles to put these vaccines within us. Do we have enough logistics? Do we have enough transporting facilities to make sure these vaccines are reaching the people that need them the most? And in Kenya, or within Africa, we've seen airlines coming together and saying, we will donate this aircraft to just make sure that vaccines are landing in Kenya, and we're seeing that again through these PPPs. And again, once they're in Kenya, we have local organizations as well as DHL and other logistical companies that are making sure these vaccines are reaching all the local sectors or centers and making sure that everyone has access to these vaccines. It's a challenge, very challenging, and we'd want to see more of these logistical companies, more of these other sectors that can come together, deliver messages, have this platform, social media, and also radios. People in the rural areas really depend on the radio to listen to these messages. So we need to have more people, maybe give airtime and talk about vaccines vaccines. What is a vaccine? Where can I get this vaccine? And have these messages localized. Again, this, in my perspective, is where the PPPs come in, where we're all working as a team, because again, without having this vaccine on everybody, no one is safe until everyone is safe. And one of the biggest weapons we have right now is a vaccine. So again, I'm just trying to paint a picture on how we can make sure that we're all working together to make sure that we are ahead of this pandemic.
Thank you so much, Dr. Mary Ann. And as we wrap up the conversation, maybe just to get a few words from Advocate Florence, how do we strengthen public-private partnership collaborations in Africa in responding to COVID-19?
I think we can, for a start, we need to know that we are going to need a multi-sectoral approach. We need everyone to be on board, from the individual to the enterprises, to government. Often in Africa, we look at government as the president and the prime minister and the cabinet and the parliament as the government. But everyone who provides a service, who works for a government ministry, who works for, to the lowest local levels, works for government and is government. So we need to, I think, first start change our approach towards how we look at these issues. When you go to a public health facility, the nurse doesn't think that they are government, and the doctor doesn't think they are the government. They look at themselves in their individual capacity and overlook the other aspect that they are providing a service on behalf of government. We're going to need a multi-sectoral approach. We're going to need the private companies continuously supporting each in their capacity. And we're going to need individuals not to negate their role. They need to remember that at the end of the day, you as the individual, have you played your part? Have you listened to what the Ministry of Health is saying? If you need to wear your mask, if you need to social distance, if you need to work from home, how do you work from home, contribute to the economy, pay your taxes, but also be able to protect each and everyone around you? I think it's very important to look at all that. And as much as we can have policies in place, but if the policies are not disseminated and communicated in the language the public understands, then they're still not of any use to all of us. So it's important that we work together as a community. And also, I think international organizations providing funding need to look at localizing content. Most of the things that work in Europe and the USA and all these countries where the donations come from, they do not work for Africans, and we need to localize things in the African context. What do we understand? If we need to incorporate our social aspects, our culture, everything, then we need to do that to actually achieve what we intend to achieve. So strategies can't come from China and they work in Uganda. They can't come from China and work in Ghana. So we need to localize everything for it to be able to work. I think that's the best thing we can do. We need a multi-sectoral approach.
Absolutely. I totally agree with you. A multi-sectoral approach that is also homegrown for Africans by Africans. And I think an important element that's also coming up here is that sometimes you look at public-private partnership as the private sector supporting the government, but it can also be the private sector supporting other stakeholders in the community, such as NGOs, FBOs, and other stakeholders. And most importantly, accountability. It doesn't mean that because we're in the middle of a crisis, in the middle of a pandemic, we should not ensure good governance and best practices in terms of accountability. Thank you so much, Advocate Florence, Reverend Anthony, as well as Dr. Marian, for your time. As we continue to enjoy the holidays, remember to wear your mask, wash your hands, and keep the social distance. I wish you a happy new year and a prosperous 2022. Until then, remember, the future is Africa, the future is today.